Now that we listened to Dr. Isaacson, what were his main points? Let's take a moment to reflect on the key aspects he discussed. Can anyone recall the first topic he covered, or perhaps highlight the most memorable part of his presentation? I'll give you a second to write them down. Normal cognitive decline. Preventable decline, such as controlling blood pressure and high sugar level, and pathological cognitive decline, irreversible changes of the brain followed by dementia and pseudodementia, or correctable forms also called delirium. Because Alzheimer's has become such a concern and we read or hear concerns all the time. It will be important for you to understand these differences as you will be in the position to assist and encourage families to seek further testing when needed. The most important point I hope you are taking here is the following. Let's review them. Pseudodementia describes various functional psychiatric conditions, with depression being the most prevalent. These conditions can simulate organic dementia but typically show the potential for reversal with appropriate treatment. Individuals with moderate to severe depressive disorders frequently develop a broad decline in cognitive functioning in association with attention deficit and psychomotor retardation. These patients may also struggle with clear thinking, concentration, decision-making challenges, notable forgetfulness, and problems with reasoning. Both depression and dementia can lead to reduced motivation, impaired concentration, and retardation, and consequently, both can lead to generalized cognitive and memory dysfunctions. Therefore, differentiating this diagnosis from dementia is important but challenging. How common is pseudodementia and delirium? Estimates suggest that between 18% and 32% of people seen by doctors. This does not account for those who never reached the doctored office and are routed directly to a care facility without proper assessment. Next, 84% of them actually have depression. Next, a certain percentage are under stress or other. Now, among people who display a form of delirium, there are 4 general categories. 1. UTI or infections. 2. Medication or hospital delirium. 3. Hearing loss. And last 4. Various deficiencies. It goes without saying that since it's complicated, there are many factors to consider. It's probably best to ask the doctor for their expert opinion and guidance. See all the many possibilities that need to be investigated. The fact that these are all reversible shows how critical it is to receive a proper workup with a team of physicians trained in identifying them. This completes our review of what we have learned in this section. We don't intend to give you a list of all possibilities, but to bring an important aspect of aging. If your loved one has difficulties, don't jump to conclusions yourself or receive advice from people who are not trained specifically in the field of medicine and neurology. There is a lot of information to take in consideration and why this is extremely important.
So what's next? How about some stretching a bit? Hey, we all need it.